Welcome to episode number 10 of Reimbursement Readiness, Business Tips for Wound Practice, presented by Kathleen and friends. As promised, I am honored to be able to interview Amiee Coriano about credentialing. The subscribers have submitted some very interesting questions that I will use for this interview. Welcome, Amiee. Is there anything you would like to say to the subscribers before we begin?
Sure. Hi, Ms. Kathleen. I'm excited to be here again today to help the audience understand the credentialing process because it is a very important piece of their practice.
Well, thank you for coming, Amiee, and thank you for providing the list of acronyms that are pertinent to this topic. I actually have about 10 of them that you have provided to us. I'm going to mention three on this first slide that we'll show, and then I will talk about all of the ones that are on the next slide. The first three that I want to talk about is the acronym EIN, which is an employer identification number. The next one is LBN, standing for legal business name. And the third is NPI, meaning National Provider Identifier. Amiee will use those and other acronyms in the interview today. And she will also use these five that I'm going to discuss with you. NPPES, and I never could remember this. It's National Plan and Provider Enumeration System. The second is PECOS, Provider Enrollment Chain and Ownership System. The third is PTAN, Provider Transaction Access Number, and that's also referred to as the Medicare Identification Number. Of course, the other is the SSN or Social Security Number, and the last is TIN, Tax Identification Number. Those acronyms are very important to know in the credentialing process. Now, many subscribers who are just starting their wound and ulcer management businesses have asked, what is the difference between credentialing and contracting? Now, in your practice management and coding and billing business, Amiee, I know you assist your clients with credentialing and contracting. Therefore, will you please answer this frequently asked question?
Sure. So the difference is credentialing is a process of verifying that a wound and ulcer management professional has the appropriate education, qualifications, training, malpractice history, etc., required to provide the highest level of care to their patients. Whereas contracting is a legal binding agreement that outlines two things: the terms of covered services provided by the wound or ulcer management professionals and/or providers, and the payment from commercial or government payer organizations.
So they really are two very different
Yes, ma'am.
processes for two very different reasons. So, why is credentialing crucial for the individual professional and or their group?
Good question. So credentialing is crucial to ensure that the provider is completely qualified to perform services. Having a credentialed group will ensure your payment to your healthcare organization from the insurance carrier. Insurance plans offer different benefits based on providers' credentialing status. This determines the cost of treatment to the patient, coverage of the treatment, the authorization requirements, along with the referral requirements, to name a few dependent factors.
Thank you. Now, the subscribers have asked about a variety of whether the provider is new or established, or whether a group is new or established. So I'm going to ask you those questions one at a time. First, the subscribers have asked about the credentialing process for the scenario that I'm about to tell you. They want to know about the process for credentialing a new wound or ulcer management group and a new provider. So both are new.
Okay. Okay, sure. Now this one's going to be a little lengthy because when you're both new, the process is a little longer than the other scenarios I'm sure we're going to talk about. So the new providers can either navigate the credentialing process themselves or work with a coding and billing company like mine who guide them through the process, which has multiple steps. Number one, you want to establish the entity type. Now, there are multiple types of entities. It can be individual or sole proprietor or a single member LLC, a C Corp, S Corp, or a partnership. Your LLC will also have the tax classification of C, S, or P corporations. Please consult with an attorney or an accountant to verify the correct entity type is appropriate for your group structure. Okay? Next, you want to designate an official who is authorized to sign all legal documents, including the contracts for the payers. After that, you want to register the group in your state for the articles of organization. Your articles of organization are also known as a certificate of organization or certificate of formation, and it is a legal document filed with the state to establish an LLC as a registered business entity. This official filing creates a LLC. It provides essential business details like the name and address and helps shield the owner's personal assets from the business liabilities. You'll typically find these templates and filing instructions on your state secretary of filing website, and you may have to pay a filing fee to complete the process. After you've done your articles of organization, you want to then obtain an EIN, also known as your employer identification number. This EIN is a 9-digit number assigned by the U.S. IRS system to identify business and other entities for tax purposes. This form is also called your CP 575 or your SS4 form and can be obtained on the IRS website. Once we have that, then we have to obtain a group national MPI, which is a type 2 MPI, on the NEPS system, which is the National Plan and Provider Enumeration System, and link your tax ID number to the group. Now, if your provider is brand new, you also need to obtain a type 1 NPI for the provider, which is also done on the NEPS site. Now, the MPI is a unique 10-digit number required by the Health Insurance Portability and Accountability Act, HIPAA, for all covered healthcare providers and organizations to identify them in healthcare transactions such as claims and billing. The NEPS system is a database managed by CMS that assigns and stores the unique MPIs for healthcare providers and health plans. And the website is https://neps.cms.hhs.gov. That's where you can go for that. Now, the final one after you do that is each provider should verify and collect the information that is required for him or her to become credentialed with the credentialing bodies. The information required varies based on each professional specialty, and we have a handout for you guys. And a typical list of the information listed by CMS and the Council of Affordable Care Quality Health Care, also known as CAQH. And we also have a list of credentialing references for further information for you guys. Every professional should ensure that their credentialing information is up to date, both in PACOS and CAQH systems. Any missing information, you're missing an attestation, or expired information can delay and potentially cause credential denials. Once the credentialing application is submitted, the payer will begin contacting the original source of the professional's credentials like your licensing boards, to confirm the details entered on the application are correct and up to date.
Well, thank you, Amy. Now I can see why the providers very often need assistance to guide them through the process because it is long. But I'm glad that you took the time to review that so that everyone understands it's something that they have to plan to do, and that there are quite a few steps. So thank you. So now that we've talked about everybody being new, here's my next question. What is the process for credentialing a new professional, but in an established entity?
The forms required are going to be the same, but the process is not as long since the established group has already processed through the verification process. Now, the new provider will be verified by the insurance to establish that he or she is approved to treat patients. Established providers can be assigned to new groups or entities through the insurance portals or roster updates based on the individual payer's process. And those processes can be found on their websites.
Perfect. So now I'm going to make a little different twist to this.
Okay.
What is the process for credentialing an established professional in a new entity?
Okay. Again, our forms are always going to be the same. We always have to have the same forms. The application for the new entity will be submitted and link the established provider to the new entity. The individual provider will conduct their process to ensure the new entity has met all the requirements for their structure type and state guidelines.
Okay, thank you. Now I'm going to switch it up and ask
Okay.
you, what is the process for credentialing a new location?
When a group or provider is adding a new location, the credentialing process should be done by your representative or yourself, and they contact the insurance company and complete the demographics update. For some payers, the location can be updated on the portals, while others may require an update form to be faxed. Some payers require groups or providers who submitted location change requests to hold the claims until that new location has been added and approved for them.
So that's why they have to start early.
Yes, ma'am.
All right. Now, that being said, speaking of time, what are the typical turnaround timelines for the credentialing the applications?
Okay. Providers provide the credentialing turnaround time based on the application type. So a new entity establishment is between 60 to 180 days. A new provider establishment is also 60 to 180 days. A new provider in the existing entity establishment is between 60 to 120 days. New location establishment, 30 to 120 days. Existing provider establishment in an established group is 30 to 120 days. Now, some payers respond faster than others. Therefore, I always advise my clients that the timeline ranges to set realistic expectations, especially when it comes to they need to start seeing patients. You need to know how long is it going to take.
Right, because you can't bill until you have all of this done.
All right.
So I'm just wondering, is every credentialing application approved by each payer?
Unfortunately, the answer is no. Credentialing approvals are contingent on the payer's need for additional professionals of a particular specialty in a particular geographic area. Payer panels can be closed if there are too many professionals of the same specialty in that area. The payers will send a notification advising if the panel is closed, and the entity can follow up later to verify if the panel is still closed. Typically, the entity is placed on a wait list with the payer for reference when there is need for more providers in their area.
Okay, so you can't always get onto a payer panel, just because your patient happens to have that payer. All right. Now, you've told us how to get credentialed. What about getting re-credentialed?
Okay. During the recredentialing, the provider's information is verified by the payers to ensure that nothing has changed since the initial approval. The credentialing representative would ensure that CAQH portals for the provider is up to date and that their current attestation is completed. Non-governmental payers utilize CAQH to streamline the recredentialing process. Now, Medicare and Medicaid require any change of information to be updated on their portals, such as PAYCOs for Medicare. The type of form required is contingent on the information being changed and/or updated as needed.
Okay. And that process is quite prescriptive by each of the payers, correct?
Yes, ma'am. It's all on their website. It'll tell you what you need to do. And when they send you the form for the recredentialing, they will also advise what information do they need and if anything is missing since they already have gone in and looked.
Thank you. Well, Amy, thank you for answering our subscribers' questions about the credentialing process. Now, as a reminder to subscribers, although my friends and I plan to cover an endless list of topics on reimbursement readiness, we welcome subscribers to submit questions and/or topics that you would like us to address, such as the ones we did today. Now, my email address is KathleenDSchaum@gmail.com. Now, when you submit questions and or topic requests, my reimbursement friends and I will do our best to address those questions and topics in future episodes. Once again, thank you, Amy, for sharing your credentialing knowledge. We appreciate your experience and guidance. And thank you also to all of the subscribers and followers of Reimbursement Readiness. Without you, we don't have anyone to educate. Now, watch for the release of episode number 11, when Amy will answer subscribers' questions about the contracting process. We look forward to talking to you soon. Thank you for listening.